I'm going to start the recording here. Welcome to the Public Health Seminar Series for today. I wanted to let you know that all these sessions are recorded and are posted on our website, the School of Public Health, University of Montana, that you can watch at any time going backwards. One to let you know, moving forward, next Monday, the 20th, we will not be having the seminar series as it is President's Day, a Holiday. But on February 27th, we will have Krista Goldstein-Cole, Dr. Krista Goldstein-Cole, and Dr. Suan Minyero. They will be doing a presentation entitled Leveraging the Adverse Childhood Experiences Study for Transformation and Capacity Building. That's easy for me to say. But today, on a much brighter note, we have with us Deshane Barnett, PhD, MS. He is the Director and Health Officer of the Missoula, Montana City County Health Department, as well as, I'm hoping, a proud alumni of the School of Public and Community Health Sciences. He will be presenting the future role of biomedical detection dogs in Missoula's public health system. Thank you, Deshane, and the floor is all yours.
All right, thank you so much. I feel like that introduction gave me just enough time to get tech squared away. So I think we'll be able to do this. Patrick, just confirming, you can still hear me? All right, good. Well, thank you everyone for being here to discuss what I think is a very exciting and interesting topic when we're thinking of the future of how public health plays out in our community, and specifically in the community in Missoula County. And a trigger warning, if you don't like dogs, you're going to see a lot of pictures of dogs in this presentation. And then an opposite disclaimer, if you love dogs, there's probably not enough pictures of dogs. So I'm the kind of person, I don't think I could ever get enough pictures of dogs, but I absolutely have a few pictures in here. But wanted to talk today about biomedical detection dogs. And that's a term that really refers to a very specific job that these dogs do. So you put these two terms together, biological and medical, and that's where we get biomedical detection dog. And so these dogs, with their training and abilities, have the capacity to help us identify both biological conditions and threats, and then medical conditions and threats. And they have been, in my opinion, underutilized in the United States, but they are actually pretty highly utilized in other parts of the world. And so today we're going to be talking about what does the practice of using a biomedical detection dog look like, and what could it potentially, hopefully, look like in Missoula County. So what is a biomedical detection dog? A biomedical detection dog is a dog who has been specifically trained to respond to smell, their olfactory sense for a particular biological or medical condition. And so these dogs usually are going to be the same types of dogs that you think about that have very keen senses of smell. So here, I show a border collie. Border collies are one of the best dogs for biomedical detection. They don't necessarily have the strongest smell out of all the dogs, but if you're not familiar with the process for dogs, smelling is actually just like exercise. It's working their brain and their stimulus system. And a dog that does 3 or 4 hours of smelling has pretty much done what would be considered a full day's work for a dog. And one of the reasons that border collies are so good and up to the task is that they are very type A dogs, and they have a lot of energy, and they really respond well to in practice. You don't usually provide the dog with a treat. You provide the dog with some kind of reward, and oftentimes it's either a toy, or it's a playtime, or it's even just physical contact, petting. And border collies really respond to that type of reward system. But border collies are not the only breed of medical detection dogs, biomedical detection dogs. But there are, when we get to the slide where we look at the actual physiology of the dog's nose, there are reasons why certain dogs are more capable when it comes to biological detection and biomedical detection. And usually what you're going to notice is it's the dogs, the longer the snout, the nose, usually the more nerves they have that can detect these odors, and then they can respond. And so it's usually what you're going to see is the dogs with the longer snouts are the dogs that are better for biomedical detection, and the dogs, with limited nose capacity. So think of your pugs, and they're cute. They're just great dogs, but they're not going to have the same sense of olfactory capacity as the dogs with the longer snouts. So when we talk about biomedical detection dogs, what is it that they're actually able to do? What can they detect when it comes to the world around us? They are often used to detect agricultural diseases. And today, I'm not going to talk a lot about that because it's not my background, it's not my specialty, but it's something that, if you're interested in that area, you can explore the literature there. But more what we're looking at is from a public health perspective. What can biomedical detection dogs, BMDDs, what can they detect? And so they're great at detecting pests. So from a public health standpoint, we can think of, bed bugs, termites, moths, and then, living in Montana, I think all of us know about invasive mussel species. And so all of these pests, biomedical detection dogs can be trained to detect them. Detection dogs, those wouldn't be biomedical detection dogs, but detection dogs can be trained to identify pests. But then when we get to the biomedical detection dogs, what is it, really when we come to the healthcare arena, what is it that they can do? And so biomedical detection dogs can be used for both communicable and non-communicable diseases. And so some of the non-communicable diseases for which dogs have been used, and there is a body of literature out there. One of the main ones is cancers, and you can see here many different types of cancers. And so the idea is that melanoma, they are able to identify the smell from melanomas, and then with additional testing, it's very easy to tell which cancer you're dealing with. And they can even be trained to determine differences in cancers based on the smell. They can also identify other non-communicable diseases, so diabetes, Parkinson's disease. I think many of us have seen, the dogs can sense when an epileptic seizure is coming on. But for the public health perspective, there are these non-communicable diseases that, when we get a few slides in, we're going to see are some of the leading causes of death in our community, and would benefit absolutely from early detection. And that's an opportunity that these biomedical detection dogs can play. And then in the era of COVID-19, we really had an opportunity to see what biomedical detection dogs can do as far as communicable diseases. And like I mentioned, not as much here in the United States, but in parts of Europe, biomedical detection dogs were really the front line defense against the spread of COVID-19, especially, and I'll talk about that on a further slide, when we're dealing with areas with large crowds, events, things like that. And so communicable diseases such as COVID-19, but other communicable diseases, tuberculosis, malaria. And so the opportunities are there for biomedical detection dogs to really be deployed and be used to help us identify a number of conditions. And so here I'm just sort of setting the stage, and then we'll talk about Missoula specifically, in Missoula County, and how we're planning to deploy these dogs. but wanted to get a little bit further into what exactly is it that lets dogs do this. And so you can see here, I hope on your screen in front of you, it's large enough that you can see the comparison between a human olfactory capability and a dog's olfactory capability. Looking at the literature, I found estimates as high up as a dog's sense of smell being 10,000 times as sensitive as that of a human's. And so really, for dogs, sense of smell is one of the primary, if not the primary way that they experience the world. Their olfactory capabilities outperform their ocular capabilities, so eyesight. And that's why, anyone who has either owned a dog or seen a dog knows that, dogs love smelling. And that's because that is the way that they are best equipped to experience the world around them. And they are smelling things that are there that we as humans just don't smell. So we are not able to perceive these odors, but the dogs can, because of their physiology. And so if you can tell in this figure, the red portions, those are the nerves, and those nerves actually are what can stimulate the receptors that let the dog know, okay, I'm now smelling this particular biological component. And when we look at it, they have so many more nerves that their ability to detect those smells is just, it outweighs ours. Again, like I said, depending, there's different estimates in the literature, but the estimates go all the way up to 10,000 times that of a human's ability. And so when we think about this in the public health realm, what is it that they would actually be smelling? Well, humans have 5 emunctories, and those are all potential pathways for a dog to be able to identify a biological or medical component. And you can see here, except I need to move you all. Okay, so you can see here that the two sections that are circled and colored, so we have exhaled air and sweat, are really the two most common receptors that are used in biomedical detection dogs being employed out in the community, because they are non-invasive. And so all of us at any given time are exhaling air. All of us, are secreting sweat and out of our pores, and dogs are able to use that, even in very minute amounts, to be able to detect the conditions that they've been trained to detect. Oops. So, and this is where I absolutely need my notes. What does the science say? And so looking through, we did a literature review, just a real cursory literature review for the Missoula Health Department, when we wanted to begin exploring if this is really a good program for us to be investing time and energy in. And in that literature review, we found several articles that relate to this topic. And so, and I'm probably going to butcher a few names here, I apologize, but Reeve and Koivusalo in 2018 published an article in Pet Behavior Science. And from each of these articles, I just wanted to pull a brief quote from each of these articles that really summarizes what the literature is telling us. And so from their article, the most pertinent issues to address before dogs would pass as a health technology are standardization of the training techniques, both intra and inter-dog reproducibility, and generalization of the detection task to the early stages of disease progression. We recommend setting realistic goals in terms of what dogs can and cannot do and adopting a collaborative approach between clinicians and animal psychophysicists. And so what that told us was that we need to set up a program, work towards setting up a program in which our dogs, our participating dogs, are all trained, and they're trained by trainers who have all been trained to respond in the same way to the same stimuli, so that what Riven Koivusalo found was that dogs do not inherently know that we want to know that they're looking for pancreatic cancer. We need to train them. And if we train dogs disparately, then we might have disparate results. And so what Riven Koivusalo were really pointing out in their article was that, yes, there is potential, but just like any other health technology, that potential is only as good as the system in which it's employed. And so we need to make sure that biomedical detection dogs, especially among the same population, are receiving the same training. And then we had a 2021 article by Gendry et al., and this was actually a literature review that was published in BMC Infectious Disease. It included, and so their literature review was separated into COVID specific studies and then non-COVID studies. So on the non-COVID side, they included 20 studies published between 2004 and 2020. And there was evidence of high levels of effectiveness in most of the studies that were published. There were a few studies that showed sensitivity and specificity that fell below available laboratory testing, but the majority of the studies actually found very high sensitivity and specificity. And then especially when we get to the COVID studies, they included 16 double-blind randomized studies exploring COVID detection with biomedical detection dogs. And what they saw was that sensitivity for many of the studies was in the upper 80s to the low to high 90s, and specificity was mainly in the high 90s. And this was at a time when our own technology wasn't reaching that level of sensitivity and specificity. So the quote from the Gendry and et al. Paper: despite the promising results of the scent detection dogs, this method is only marginally or not used in the field of human medicine. The majority of medical professionals continues to rely on diagnostic standard methods, although the canine medical detection method achieved equal or even higher rates of diagnostic accuracy. We have another article by, again, I might be butchering a name, but I'm going to say Mon et al. And this was published in 2022 in Frontiers in Medicine. And they were looking really at the ability of biomedical detection dogs to serve rural communities. And what the quote here is, biomedical detection dog of a pandemic human disease caused by a virus is not only possible, but it's faster and more sensitive than our gold standard diagnostics. And then our final article, Devalier et al., was published in the Journal of Breath Research in 2022. And the quote that I pulled from their article: the present study's results extended our knowledge of the detection of SARS-CoV-2 infection by trained dogs and strongly supports the concept of dog detection as a frontline, non-invasive, efficient, cost-effective method for screening retrieved face masks for COVID infection. And so again, the literature on this is limited, but is definitely emerging. And like we saw with the Gendry and et al. Article, you know, there definitely is a body of literature to pull from. And what we see is that biomedical detection dogs have the potential to be effective in both communicable and non-communicable disease detection. So all of that just was to really set the stage. And now what are we planning or hoping to plan to use this for here in Missoula? And so just on this slide, what you see age-adjusted death rates for 10 leading causes of death. This is in the United States. What we want to do now is really dig into Missoula County and look at data and find out our 10 leading causes of death in Missoula County. And then among those, begin identifying which of those conditions would lend themselves to biomedical detection dog detection. And so you see several on here, cancer as number 2, COVID as number 3. We've got diabetes, kidney disease. And so those are all ones that we could potentially be training biomedical detection dogs in Missoula to identify those particular conditions. And then the idea is that the biomedical detection dogs are one tool in our tool belt. They are not the end all do all, but they are one tool, and there are particular ways in which they can help us do our job better. A few subpopulations that would benefit from Missoula Public Health instituting a biomedical detection dog program. One is our outlying rural communities, and that's for a couple of reasons. One is the transportation issue, and that, is someone going to, travel all the way from Sealy down to Missoula to do, all of the preventive testing, that they should be doing? Or, if we bring the dog up to them, are they more likely to get their preventive care screening? And so the idea is that these dogs can easily be transported to these outlying rural communities where we see historically and traditionally low rates of prevention screening, and they can then be deployed in those communities. And then also within Missoula and around Missoula, our congregate living centers, the residents there are in a position to easily be screened. And that also gives us the ability to screen many residents at one time. And then, I mentioned this a little bit for our role, but really just think about it. Prevention screenings, especially the invasive prevention screenings, our rates are they're never high enough. We, as a population, we don't see the rates of colonoscopies that we should see. We don't see the rates of pap smears, of all of these screenings that can help us detect cancers or other conditions, because who wants to go get a colonoscopy? Like, it's not fun, it's invasive, it's scary. It's, if you're, think of the grandpa who's, I'm thinking particularly of my grandpa, who's an old rancher living out in a rural part of the county. He's not going to want to drive in for a colonoscopy unless someone's making him. And we have an opportunity here with the biomedical detection dogs to work with a population that would normally be under compliant or non-compliant with prevention screening, and use these biomedical detection dogs to then, hopefully identify as early as possible some positive cases, and then this individual, has the information that, they likely do need to go get the more invasive testing. But at least what we've done is hopefully convince them of the reason and the importance that they need to go do this more invasive testing is because they've tested positive through the biomedical detection dog. And so all of these subpopulations could benefit greatly from biomedical detection dogs, but in reality, all of us can benefit. Any one of us, whether or not we live in a rural community, whether or not we're in a congregate living setting, even if we routinely keep up on all of our preventive care screenings, all of us could potentially benefit from biomedical detection dogs in Missoula through one of two paths, either directly. So we do not know when our next infectious disease pandemic will come, But I think that a lot of people are very convinced that it will come during our lifetime. And so we could, if we have biomedical detection dogs already employed, we're using them throughout the community, and then we're just quickly turning and training them for a particular pathogen. That's much easier than starting from scratch during a pandemic. And so there's that opportunity for direct benefit, but also just the indirect benefit of knowing that our community potentially could see lower rates of both communicable and non-communicable diseases. Whether that's us or our loved ones, our friends and family living here in the community, we all benefit from seeing reduced rates of diabetes, of cancers, or of cancers that were caught early in our. So maybe it's not that our positivity rate has changed, but our survival rate and our years of life loss goes down because of early detection. And so there's this opportunity for biomedical detection dogs to really come in and help public health do its job well. And so how will we go about this? And there's a couple different approaches to employing a biomedical detection dog. And when I say that, I don't really mean, we're going to write them a paycheck, although I'm sure that they would appreciate a check written out for treats. But the idea is when we're employing them, we're using them throughout the community. And so you can do this in several different ways. And I'm sorry, I just want to look at my notes and make sure that for our outlying rural communities, like I mentioned before, we can actually put these biomedical detection dogs in a mobile clinic, in a van, and take them out to the surrounding communities. And so that person never even has to come into Missoula just to participate in the biomedical detection dog program. There is also the opportunity for us to employ these dogs at large events. And we saw this a lot for COVID-19 in large European cities. And I got the opportunity to attend a presentation a few months ago about biomedical detection dogs. And this was a researcher from France, and in Paris, he actually had pictures of, it was a concert that was being held, and there was thousands of people, and they were able to, they had these numbers marked out from 1 to 200. So you would have 200 people come in, walk in, stand on their marker, because they're in a single line. So they go, they stop, they're standing on their number. They put their the face mask that they were given specifically for the test. They put that in the canister. They stand there, and then the dog literally runs down that line of 200 people in a matter of seconds and can accurately stop and identify and say, okay, number 7 has detected COVID. Number 82 has detected COVID. Number 117 is, and they run through these 200. They would pull out the ones who were detected, and then they would actually perform a rapid test right there on the spot. And then they would have the next line of 200, and they would actually get people in and out of concerts for the COVID testing quicker than the ticket takers would. So this is not a prohibitive process whereby, if we're going to be working at a mass event, people are going to have to come 3 hours early in order to go through testing. This was literally just part of their entrance into the event. And in doing that, they were able to pull out those individuals who had been detected as positive with COVID, and then provide them with further testing, and then deny them entry into an event to help stop spread stop the spread of COVID. And so there are different ways that this can play out in our community, but there's a real serious question here. What if I'm afraid of dogs? And we absolutely do have a large number of our community members who are afraid of dogs. And so the way that these dogs can be employed, it can happen in a couple different ways. So you can actually have, just like we see at airports and other places when they're looking for explosives or illegal substances, the dogs actually can be loosed throughout a crowd or even without a crowd. You could have the dog interact directly with the individual, but for biomedical detection, that's not necessary. And so what we do is we collect a specimen, and then that goes into a receptacle, and the dog actually smells the receptacle. So in that process, the person who is actually enjoying the benefits of biomedical detection dog testing, and I'm sorry to say this for those of you who love dogs, you never even see the dog. You wouldn't know that there was a dog on the other side of this wall, that they were sniffing this receptacle, and that they were doing the work of identifying non-communicable and communicable diseases. All you would know is that you have just placed a specimen in a jar, and you're waiting for your results, and your results, depending on the setting, could come in within just a matter of seconds. And so I need to step back because I forgot to, on one of the slides, talk about so what is it that's actually going in these receptacles. And so that can really vary. One of the things that they did for COVID was they would give disposable surgical masks and ask the person to wear them, and they only had to be wearing them for 2 minutes, and then they could put them in a receptacle, and the dogs were able to identify the COVID positive cases. And then they still had, that was a disposable mask, so they still had either their own cloth masks or K95s, N95s, KN95s, whatever type of mask their personal mask was, but all they did was wear this disposable mask for 2 minutes. And so there are also cotton pads that can be used. You wipe them, under your arms or in your groin area, and they can actually then, with the small amounts of sweat secretion, they can is enough that you put that in the receptacle, and then the dogs are able to identify medical conditions just based on that sample. And so, and again, sometimes what they'll do, depending on what they're looking for, is that you might actually have the sample under your arm or in your groin for about a minute or 2 minutes. And then you just, deposit it in the receptacle. The dog comes by, smells the cotton cloth that was in there. And you can see here that there's glass jars and then tin receptacles that go inside the glass jars, so that there isn't infection between you remove the one receptacle that has the sample from the one person, and then you put the next sample in, but there's no cross contamination. So it's a method that is very effective. It is a method that is pretty cost effective, but has a significant return on investment. So we in Missoula are looking at, we're working with a veterinarian who actually has experience with detection dogs. And unfortunately, what we've seen is that the United States has not embraced this practice as quickly as other areas. And so this veterinarian actually has been working with biomedical detection dogs in Africa for the last several years, but she's based out of Missoula. And so we are going to be setting up a training series for the trainers, the animal trainers. And then, so there is absolutely a cost associated with that, making sure, because again, like we heard in the Reeve and Kaivuso article, I'm sorry, I know I said that name wrong, but the effectiveness of this program really depends on how systematically and how well we've designed the program. And so we will have these trainers will all go through the same training, and then they will train their detection dogs, and then we will actually be doing inter and intra dog testing for their ability to detect whatever, like I said, we haven't decided yet specifically which conditions we're going to train for. One thing though is that a single dog can be trained for dozens of different conditions. And so a dog can be trained to identify both diabetes and COVID. It's not one or the other. And you can even train them with different tells, so that if they identify COVID, they sit down, maybe on the left side of a dot. If they, have smelled diabetes, they sit down on the right side of the dot, something like that. And so we're going to be setting up that training program. We don't have it in place yet. But then the idea is that our trainers will be trained, our dogs will be trained, and we will hopefully be aiming to employ these biomedical detection dogs in Missoula, hopefully by the end of the year. So by the end of 2023, it is our plan to have that in place. And so obligatory slide for the references that I spoke about today. And then just wanted to have time to do question and answer, because I'm sure that there's lots of questions that I just hadn't thought of when I was planning the presentation. So.
Okay, well, thank you, Deshane. That was wonderful. I happen to be someone who does like dogs, so I loved all the pictures you had there. I see there is a couple of questions in the chat. Are you able to see the chat at this point?
I am. So, let's see something. How easy or hard is it to retrain a cancer detecting BM to detect an infectious disease? So I am not a veterinarian. I'm not an animal specialist or an animal behaviorist. So, but this question about how easy or hard is it to retrain a cancer detecting biomedical detection dog to detect an infectious disease? What we have been told by the veterinarian that we're working with is it is actually fairly simple. What's the harder thing is what we've been told is training the trainers. Training the people takes more time and work than training the dogs. And so we have to make sure that the trainers are actually putting in the work that needs to be done, so that these dogs are able to do what we're asking them to do. And my understanding from the veterinarian is that on the dog's end, it's actually fairly easy to train them. We just need to be systematic and well thought out about it. So, and then I see from Krista, have you considered taking a public health approach to training the pups, for example, using youth development organizations like 4-H, or by expanding prison-based dog training programs? I would say that is something that we would absolutely consider down the line. I think as we're initially getting this up and going, one, we are going to have limited funding. We're working preliminarily right now. We are working with City Council to hopefully get some funds set aside for this. And the idea is that we will have several trainers trained. And then the idea from there is that maybe we could actually expand this into a program where we get to work with a prison-based dog training program. But this is us taking baby steps. And I see what everyone is always terrified to see, that we have a veterinary behaviorist here as I'm sitting here talking about their area of specialty. And so Patty Brewster can absolutely correct everything that I misstated here. But yeah, so then the idea is that we'll be working with veterinarians and behavioralists who can help us come up with ideas for how to hone the program once we have it up and running. And from Anna, I see, is there any risk for human to animal transmission for any of these diseases the dogs are working to detect? And so I, again, am not an expert on this, and I see Patty, if Patty would like to hop in, please feel free. But what I would say is that in the literature that I've read so far, the system and the protections that are put in place, I've not seen anything about a risk of the biomedical detection dog contracting the disease that they're aiming to detect.
Hi, I'm Patty Brewster. I can chime in.
Yeah, no, that'd be great.
Nice to meet everybody. I'm actually a veterinarian from the Dominican Republic, and I've been working with scent detection dogs most of my life. My own dogs are scent detection dogs. we do tracking, nose work, and we do search and rescue. So I can answer, you are right on, Deshane, on a lot of these things. I could just go into a little bit more detail of what the questions were saying. So dogs do have a memory bank in their head, and they can, just like you were saying, Deshane, they have a memory storage that is incredible. So they can tell the difference between cancer, diabetes, and everything like that. The problem comes in when we had dogs that were trained on marijuana detection. We had to retire all those marijuana dogs because marijuana became legal. And you can't tell dogs, search this drug and not this drug. So adding to their profile is just fine, but taking away from their profile, like you can't tell a dog, don't detect this. So that's an example I have on that. The other thing too is, as of now, COVID-19 was suspected that could be transmitted to, domestic dogs and cats, as well as other domestic animals and strains, but the dogs are rapidly going by, or at least using like the masks. So that's not a problem. The problem with using public people, like to use 4-H outreach or people like in prison outreach, is that this requires timing. It requires behavior knowledge of the dog picking up scent, because there's a whole behavior behind how dogs pick up scent, and you have to have really good timing, and you have to be a team. So when I certified my dogs for search and rescue, I'm certified with each dog as a team, and as a person and a handler as a team. So it's really difficult to like have the public help in these situations. It's a great idea. I'm not saying it's not something we could look into the future, but it takes a lot of work, and it takes a lot of bonding between you. You have to really know your dog's way of scent, because each dog detects scent differently, and we don't necessarily like to train a behavior to the scent detection. We allow them to detect. So some dogs will sit to detect scent. Some dogs will lay down. Some dogs will paw. You just really have to pick up and be quick on your reinforcement rate, which and detecting scent. The other thing is, you guys were talking about, have you looked at literature or thought about wildlife disease detection? I'm actually working on a project right now that we're using dogs in the Missoula area from Working Dogs of Conservation. I'm doing my PhD project with them, and we're looking at Mycoplasma ovi and bighorn sheep. So we are using dogs in conservation and looking at wildlife diseases. And that's all I'm sorry, I just like chimed in. But
no, that's
yeah.
great. That's great. It's always nice to have someone who's a practice expert in the field. Because this is, like I said, this is something that for us, we are just stepping into this world. And we're probably going to learn lots of lessons over the next couple of years. But the idea is, and I know that there's potentially folks on from other parts of the state, but what I'm really excited about is that I believe we will be the first health department in the state of Montana to employ biomedical detection dogs. So that's great, in that it's exciting, but that's also means we're gonna have bumps, and we're gonna learn things as we go. And so Celine, I see the last question on here that I see is about the balance of health disease detection and privacy, HIPAA compliance. And so yes, like I mentioned at the large event in Paris, the individuals lined up on the numbers, and they were I guess that would still be, I mean, HIPAA I don't think would necessarily come into play, but privacy, yes, you could what I would say is that we would need someone much more versed in privacy law to tell us how that would work at a large event. What I would say is that they have been already in use in many places throughout the world, and even in other parts of the United States. And so there is, I don't have the exact correct answer for how we address privacy and HIPAA. But what I would say is that I know that the answer is out there and we will find it as we're looking to start this really exciting new program.
Okay. I think we might have time for one more question. If there's another one out there, if you could put it in the chat or just open your mic at this point. Okay, hearing none at this point. All right.
Hey, I've got a question. This is
Oh.
this is B-Rad
Hey, B-Rad.
for Deshane, and I'm just curious. So as far as the people are concerned, like the infectious disease office probably needs a dog, and you're probably using existing employees to be dog trainers, or have you thought that through? Maybe you're gonna have a new set of staff that's dedicated to the dogs, or
Yeah, so actually, the way that we're working right now with the veterinarian is that we will be hopefully putting forward a proposal to get funding from the city and county to do this. And that funding will include the trainers. And actually, Patty mentioned one of the local organizations. And I'm sorry, Patty, if you're still around, you can hop on. It's called Conservation.
Working
Something.
Dogs for Conservation.
Thank you. Working Dogs for Conservation. And so there are already individuals in the community. And so what we would be doing is getting funding to provide them funding to help us train the dogs. And so we would not be, I got really excited because I thought these were dogs that were going to live with us at the health department, but that's not the case, unfortunately. So, but the idea is that these dogs will be available and at our disposal to employ for this public health purpose.
well, thanks so much. I really learned a lot and appreciate it.
Okay, well, thanks everyone. I think we are out of time at this point. Thank you, Deshane, for presenting that presentation. It was wonderful, very educational. Just want to remind everyone, we do not have a presentation, a public health seminar next Monday, the 20th, but we do on the 27th, and we hope to see you then. Till then, thank you. Goodbye.
And Patrick, all I'll say is that in 2 years, we'll come back with a lessons learned presentation.
Excellent. Thank you. Looking forward to it.
All right. Thanks, everyone.